Well, hello, hello. I'm Jane Hogan, the wellness engineer, and this is Wellness by Design. Welcome to the show today. We're talking today about outsmarting menopause with our guest, Dr. Jessica Drummond. Jessica, welcome to the show.
Hi, thank you so much for having me. I'm honored to be here.
So many women in my audience are like my age, or coming up perimenopause, many menopause. And so, what you've got to offer today is really, I know, going to be very insightful for the audience. So, if you're watching live or if you are watching the replay, feel free to ask questions and we will try to get to them. So, Jessica, you're the CEO of the Integrative Women's Health Institute, and you're the author of a book called Outsmart Endometriosis. You got 20 years of experience in women's health, and so I'm really thrilled to have you on here. You've been helping professionals because you train the trainers, right? Helping professionals in more than 60 countries around the world. And you lead all these virtual wellness programs for women. So, really perfect person to talk about the I'd say struggles a lot of women have with perimenopause and menopausal symptoms. So let's kind of get started. Why did you start focusing in on women's health?
Well, this has really been the work of my entire career. I started my career in sports medicine and orthopedics as a physical therapist. I was an athlete as a kid and thought I would be really into that, and I was, but pretty quickly I began to specialize in women specific orthopedics, sports medicine. So, like women who had shoulder issues related to breast cancer surgery or back and pelvic pain related to pregnancy and postpartum, and, you know, postpartum and prenatal athletes. And so then pretty quickly, my practice evolved to working with chronic pelvic pain, chronic sexual pain. And then later, after my oldest daughter was born, which she's off to college in a month, so it was a while ago now, I started to realize that the chronic pelvic pain that my clients with endometriosis or vulvodynia or painful bladder syndrome or even bladder leaking and things like that um, also had a hormonal component. And I ended up going back to school and got a doctorate in clinical nutrition. And I've really been very integrative from a nutrition and structural approach, because what I realized is almost every women's health issue is complex. So I still work one-on-one with clients and deep dive programs of really complex things. And just this morning, I was working with a woman who had some like facial acne and rashes. And then when we get under that, so like she had seen many, many, many other doctors who just put tons of creams on it, right? So like we always, our system is focused on like quiet the symptom.
Yeah, and we know that's not really the problem.
Right. And so when you get into women's health, you realize like, oh, the digestive system is involved, the immune system is involved, the endocrine system is involved in all of these different cases. So when we address it from that approach, people start having so many different symptoms go away, not just clear skin, but finally, oh, I'm not weight loss resistant anymore. I
Mhm.
can sleep. I'm not sweating all the time. I'm not freezing all the time. My hair's not falling out. So it's very rewarding because through the trajectory of my career, I didn't come through conventional medicine. So I don't think in terms of one symptom, one medication, or one symptom, one
Right.
supplement, which is kind of what happens when people transition from medicine to functional medicine. It's just like, oh, what supplements for that? What lab tests for that?
Yeah.
No, we really have to look at your life underneath it all, and how you move, how you sleep, how you talk. And it's so rewarding because when women heal in the perimenopausal and menopausal ages, 30s to late 50s, and then much older, I certainly work with women in their 60s and 70s who have sexual pain, for example. Um, then they have all this energy for like decades
Mm.
of creative work. One of my clients right now is an artist, and she recently rebuilt herself an art room, and she hadn't done it in her home for a long, long time. So that's what I love about women's health. It's that when women get their health and their energy back, they do amazing things with that.
Ah, what a beautiful gift, because then they can live their life fully, right? Instead of being held back by these different symptoms that are taking away their energy, or even the root causes behind them, zapping their energy and stopping them from living a full life. So let's dive into what's the difference between perimenopause and menopause? What are the different symptoms?
So menopause is officially 1 year after your last period. So you don't really know you're in menopause until like after
Right.
you're in menopause. And up until then, usually starting in the 30s, women will start to experience mild disruptions in their cycles. They usually start out being a little bit longer. So every, instead of 28 days, maybe 35 days, then maybe 45 days, even 60 days between cycles. Their periods may change in terms of the length or the heaviness or the lightness, because what happens is you start occasionally either skipping ovulation or having less egg quality. So, it's not as robust of a cycle in terms of fertility. And then later into the 40s and 50s, the periods get closer together, where we're sort of almost skipping that luteal phase, which is the second half of the cycle after the egg has been released. And if it's fertilized, it will be implanted in the luteal phase. So that starts to get a little bit skipped. So you might have 21-day periods. You might have like occasional like gushing of blood. Sometimes the symptoms get worse if people have estrogen related headaches. That often is exacerbated if someone has a histamine issue, because estrogen irritates mast cells, which can make you then have migraines around the time. Maybe you used to have headaches, but now you have bad headaches or headaches more often. So it's this transitional time. Metabolically, things change. Women, because we're losing our estrogen. So essentially what happens is over time, estrogen is declining, but not in a straight line. So progesterone is relatively, decreasing over time, kind of steadily, but estrogen decreases over time like this. Like, it's like up, down, up, down. So some days you'll have like breast tenderness and bloating and cramping, which is more a sign of high estrogen. Other times you'll have big crashes in estrogen where you might get migraines or weight loss resistance. Estrogen also modulates insulin. So women are really sugar and alcohol sensitive in the perimenopausal and menopausal years. So one glass of wine could totally wreck your sleep, where in your 20s, you could drink vodka all night and you're fine,
Things.
Yeah. So it's because when we lose that hormonal support, it disrupts not just your ovarian function, but your metabolic function as well. So that's kind of the change that we see. And all of this is exacerbated by a disruption in the autonomic nervous system. So the more that women, so there's sort of 3 states you can be in. I tell my clients, you can't be in more than one at a time. One is fight or flight, so a high stress, anxious, jittery kind of state. One is parasympathetic, ventral vagus activation, where you're really just like settled in. I say that sensation you get when someone at the salon washes your hair, that's actually a direct stimulation to the vagus nerve, which one of the cranial nerves that comes out behind the ear. That settles the nervous system. And that's the only state in which we can kind of be optimally healing or healthy or kind of at rest. Or it can tip too far and you can be in parasympathetic, but you're like stuck in a freeze state. So in nature, this is when like a tiger has like a deer or something in its clutches, and that thing just plays dead till the tiger puts it down and walks away. Then if the deer's not actually dead, it can like pop up and run away. So for humans, this looks like stuck motivation, depression. It can be like an actual freeze, like if someone is trapped during like a big accident or something like that. It's when fight or flight is not adaptive to kind of save you from a survival standpoint, you'll freeze. But when we're thinking in terms of chronic stress, which is more often what women are dealing with in this age, aging parents, issues with children, issues at work. Those are the main things. Just general stressors of like living in society,
Right.
too much phone exposure, right? That then they can be stuck in either, some people get very anxious, fight or flighty, but some people are just like, they just check out. It's also a safety mechanism. So when you're in either of those states, your menopausal and perimenopausal symptoms will be much worse. So you can have dysregulated estrogen and even somewhat dysregulated insulin and not have like hot flashes, let's say, until you layer on that stress.
Right. You're making me, so many times I think, hundreds of years ago, thousands of years ago, women have gone through menopause and they didn't have to go get hormone replacement therapy. It wasn't available, but they got through it. Do you think that our stressful lives today make all these symptoms worse then? If that's what you're saying, we're living more in a state of emotional stress, so then it kind of makes sense our symptoms would be worse. So then we've got society trying to address that with different approaches.
Yes. I mean, I think a couple things. First of all, women, so I'm fortunate enough to have known two of my great grandmothers well into my teenage years, and my oldest, my most longest living grandmother just died like less than 2 years ago. And so she was 97, I believe, and fully cognitively with it. So, I had very close interaction with women in their 70s, 80s, 90s for
What a gift.
my whole life. Yes. And so, yes, two things. They did not take hormone replacement therapy by and large. They did, in general, not live as long until this most recent generation. So, my grandmother's generation, whatever the generation is before the baby boomers, right? But then the other issue is that, yes, the chronic stress is different. So, and we do have strong research that shows that's the differentiator. Any kind of chronic underlying stress that pulls you out of that, just got out of the salon, will actually exacerbate the metabolic issues, the cardiovascular issues, which is really what hot flashes are. It's a vasodilation issue, all of that. And we have lots of tools for it. And I do think we have strong data that there's a beneficial place for hormone replacement therapy. The problem is what happens usually is it's just sort of prescribed in either one of two ways. One is sort of like just go on the birth control pill, kind of, which is a very mush. It's like a giant Band-Aid when you need like skilled plastic surgery, right? It's like, it's too mucky of a solution for most people. It's not precise enough. And even with hormone replacement therapy, same problem. For some percentage of women, it's the best, easiest, correct solution. But for most women, we also have to consider how healthy are your hormone receptors? How healthy is your life? Because if the hormone receptors are blocked by heavy metal toxicity, the hormone replacement therapy can make things worse. And how many times, have we worked with people who've been on birth control for 20 years, then they come off it and things go haywire because there's been this kind of like quiet suppression or like silencing of the early warning signs. So I'm totally in favor of all things from hormonal birth control to hormonal replacement therapy as part of the solution. But what we often not skip doing is healing the underlying system. And that starts with the nervous system. but it also involves the digestive system, the gut microbiome. If someone is riddled with yeast overgrowth or have bloating from small intestinal bacterial overgrowth, we can like balance the hormones, if you will, whether it's using synthetic or bioidentical or even herbs, things like maca, which is actually a food, or chaste tree vitex or things like that. But that's always the tip of the iceberg. I almost never, so I work with hormone things all day, every day. This is my job. But I almost never test hormones anymore, because especially if women are under 40, 45, once you get over 40, 45, then it's helpful to see if like you have estrogen dominance or something, but not until we get all of these other systems fully optimized. And for some women, that can be as simple as really understanding what their stressors are. So we use fitness tracking, heart rate variability tools. We use continuous glucose monitors. We use lots of data because every case is different. And there isn't like a protocol. If someone gives you a perimenopausal or menopausal protocol, like run away, because it highly dependent on what's going on in that person's, not just their physiologic system, but their life. Like, do they have a safe, restful home life? Do they have a good social connection with people?
Right.
What are they eating? What's their water quality like? There's so many factors that have to be at least assessed before just layering on the top end hormones, if you will.
Right. So very much looking at someone's lifestyle and working with that first. We've got Margie watching, and she says she's in a constant state of freeze due to trauma. And so when someone's in that kind of state, I mean, I know you can't you can't help someone, in this little short period of time, but generally, are there tools to help people get out of that freeze state when they're in it? Because I think people understand the fight or flight state, but what about the freeze state?
So it's the same thing. We want to shift from kind of an inappropriate overact or activation of certain nervous system pathways into the better ones. So step one is I would start asking, where in her life does she feel most safe, and start being more often there, like around those people, listening to that music. There are certain frequencies of music. So it's called solfeggio frequencies. You can get access to this for free on Spotify or YouTube, that lower cortisol levels. Now in freeze, you may not even have high cortisol. You might even have low cortisol, but there are other frequencies, earlier frequencies, like I think it's 174 and 362, 364, something like that, 368 maybe, that kind of modulate your stress hormones. So that's one way to start. Another way to start would be just to simply be in nature, like take one full day a week where you're fully disconnected from any news, any blue light devices, any electronics. Part of the problem why we get staying in freeze is one, yes, trauma. So absolutely a part of the team would be a trauma-informed mental health therapist. So someone who does internal family systems work, EMDR work, things like that is really essential. And we can use movement to inform creating new, like opening the window of safety. But we have to do this gently. So one way I like to describe it, okay, imagine, I'm going to get the screen here. Okay, imagine my arm was in a cast like this for the last decade, right? It was a trauma. Right. And then the nervous system was like, don't move. You're safe right here. Then, okay, you go into a trauma-informed movement. So we take the cast off and we support. So where can you be comfortable to sit and breathe? You might only be able to breathe at slow 5 second in, 5 seconds out for 1 minute a day. Let's start there. Maybe you can only do it in certain positions. Then we get you starting to move this arm in that safe place. Then we move it all the way. You're not going to go from like casted for 10 years to conducting an orchestra. Your elbow can't take it. And it's the same thing with the nervous system. You can't go from freeze for a decade to go out in the world.
Mm-hmm.
Oh, by the way, there's a shooting every week in your neighborhood. And, every news thing you click on, every bing of your phone is negative. Like if you're like a chipmunk, you're going to go right back in your cave.
Right. Makes sense.
So we have to be very patient with building resilience in the nervous system. And the other way I like to do that actually is through food. Start thinking of food as building resilience. I have my clients who are really kind of frozen. 3 meals a day, nourishing bone broth based, heavy vegetable, heavy protein soup. And if it's too hot in the winter, then maybe we'll do something similar as a smoothie, or juices, things like that. You've got to give the body lots of signals of safety.
Oh, I love that.
Everything from food to people you surround yourself with to news you expose yourself to, everything, because so many people are trapped in trauma that it's perfectly understandable and normal for the nervous system chipmunk to want to go back in the cave. It makes no sense for the chipmunk to stand in the open,
Right.
under circling, things that could eat it. Right.
I just love that, signals of safety, and just keep doing it more often and more often for longer periods. And I had to do a similar, even though I wasn't going through these symptoms, although I kind of was when the RA hit. I turned 50. I also like stopped menstruating. That like it was all happening at once, right? Hot
Yeah.
flashes.
And that happens, people think that it's this diagnosis, but then you take a deep breath and you think, but I was also perimenopausal, menopausal. That counts.
Yeah. And that what you talked about there, signals of safety, I found that really helped for me. I just had to keep, because not go all the time. Just give myself permission to say, okay, I need to look after me and be kind to myself. And I think a lot of us women, we're naturally caring for other people so much that it can be hard for us to do that. But Jessica's giving you permission and I'm giving you permission to do that. It's time to look after you. So
it's almost more than permission. It's prescriptive.
Yes.
You must.
You must. Even
Otherwise,
better. Oh my goodness.
will literally not heal and you will only get worse.
Right. And we can show up better for other people down the road when we look after ourselves first. So it's really an act of kindness for other people too. Let's think of it that way. Jessica, so good. I really love what you're saying. Today, we're talking about perimenopause and menopause. And I also had you speak on my Becoming Pain-Free Summit, which goes live on Monday. And on that summit, you talked about endometriosis and the pain of endometriosis. So can we just have a little, what would you say would be the top thing people would learn from your talk at the summit?
Well, I think it's very similar in the sense that you have to take a very holistic approach and look at all of the systems. And we have to develop a unique plan for each person. And I think one of the things that people with endometriosis in perimenopause, and sometimes people even who don't have endometriosis in perimenopause or menopause, are dealing with sexual pain. And it can be anything from low estrogen vaginal dryness, which could be side effects of medications with endometriosis, to menopause. And we have so many tools for that. I have women in my practice having healthy, joyful, pain-free sex well into their 70s, even 80s. So if you're struggling with sex and you want that back and it's painful, there are lots of tools. And we can address libido too, but particularly around pain, we have many, many tools.
Right. Okay. Around pain. And can we just take a minute to address libido? Because I know that's something that a lot of women my age struggle with. So what would you suggest for that?
Well, you have to start. So the estrogen that you get post-menopausally, which will help drive the libido, also testosterone, which we can talk about in a second. is driven by the health of the adrenal axis with the brain. So that whole conversation we were just having about bathing yourself in signals of safety fills your stress resilience tank. That's your adrenal glands. And if that's depleted, you actually will not have estrogen postmenopausally, very, very little, which is a real struggle when it comes to libido. Also testosterone. Both of those things, one of the most nourishing things you can do is let go of sugar as much as possible and replace it with nutrient dense foods. I am a foodie. I think food should be delicious, but how can you make it so nutrient dense and actually full of beneficial fats? Instead of having ice cream for dessert, first of all, the timing of when you eat sugar is important. So if you're going to have more of a dessert like thing, even if it's natural sugars like fruit, do it like after lunch when you're still active in the day versus right before bed. And then do something like, fruit roasted in coconut oil, or ice creams made out of coconut milk that are full of really healthy fats and then a little bit of natural sugars. So because those two things will really impact your estrogen and testosterone levels, which are a big driver of sex drive.
Oh, so helpful. I know that what you just said is going to be really eye-opening for a lot of women. They're probably not realizing that the foods that they eat are having an impact. So thank you. Thank you so much for that. And I'm really delighted to have you as a guest speaker on the summit. You're on, I think, the very last day of the summit, where I've got people, the speakers addressing specific conditions. So there's a link there in the comments, and we'll share it in the show notes as well, to sign up for the summit if you haven't done it yet. All kinds of great speakers, including Jessica. And Jessica, I always ask my guests one last question. So this is, oh, I don't know what happened to it. Okay. We'll just say it. So this show is all about intentional living, right? Not about designing a life. So what would you say is one thing someone could do today to design better health, design their life for better health? What's one simple thing they could do?
So in our program, we give all of our clients a fitness tracker. It's called a Garmin Vivo Smart 4 that helps them to bring awareness to their stressors using heart rate variability.
Love it.
Women in our 40s and 50s literally don't even know what's stressing us. We're so stressed. And so we don't know. Some of my clients are stressed all night long, even when they're supposed to be sleeping. So having some awareness of that, using heart rate variability technology, HRV technology, which is widely available in watches and rings and all kinds of things now, starts to teach us where our stressors are, so we can build in those times where we're resting and recovering from stress.
Ah, I love it. I might get myself one of those. I've got an Aura ring, but it seems like it only tracks HRV during the night.
Yes, that's
So
the downside. I
yeah.
like the Aura ring too. I have one on myself. But the Garmin is what we use in our programs. The data shows using it for even just 6 months, which is what we recommend. You can wear it forever if you want, but 6 months, then the gains will stick. So 6 months, and the HRV of the watch we use in our program gives you that daytime knowledge. It doesn't give you the raw data, but it gives you a very useful algorithm. And so we work with that because it's exactly right. Like the nighttime HRV is really helpful for kind of tracking your general health, but to pinpoint like, okay, which meetings are really messing up my nervous system and I need to really support, we call it scaffolding. You like support yourself before and after, which people, which experiences, which foods, which bedtimes, we have all this power once we know what's shaking our nervous systems up.
I love that. I'm very data driven because of my engineering background, and I love sort of seeing these correlations. Like I've actually stopped drinking alcohol since, well, this year, But I could see it every time I had like a Friday evening when I had alcohol. I could see how it impacted my sleep. It impacted my heart rate variability. I could see my readiness number for my Oura ring would go down, and hot flashes. I have not had hot flashes since I stopped. So
Yeah.
when we can correlate our lifestyle and food and events, different things like that, with the real data, like the data doesn't lie, right? So we can get a great picture, and it is really eye-opening, and I think helps people become motivated to make the changes. So thank you so much for that information. And Jessica, where's the best place for people to find out more about you?
So for our professionals, we do a lot of education for clinicians and health coaches at integrativewomenshealthinstitute.com. And if you'd like to work with our team on any of these issues, even if you don't have endometriosis, for now the website is outsmartendo.com or outsmartchronicillness.com. And I don't really like to think of perimenopause and menopause as chronic illness, but it can be in some women, especially if you're also dealing with autoimmune issues or post-viral syndromes or, history of period issues or hormone issues or endometriosis or low libido, that we take the same approach to healing from the inside out. And I really do think, you mentioned that you stopped drinking alcohol. I mean, look, I love French wine, Italian wine, love it all. But I haven't really had any alcohol in more than 2 years. And I think that's the most powerful thing you can do to be healthy through the menopausal years.
Well, that means a lot coming from someone like you who helps thousands and thousands of women. So, Jessica, thank you so much for being a guest today. And thank you for the work that you're doing in the world and really making women's lives more meaningful so that they can be the creative, wonderful people they're meant to be into their senior years. So, thank you so much for that. Thanks for being a guest today.
Thanks so much for having me.
And thanks to the audience for watching, listening, and thanks for tuning in. Don't forget to sign up for the Becoming Pain-Free Summit. There are so many fabulous speakers and free gifts, and you'll learn so much. And knowing that there's so many people, like 25% of the population suffers from chronic pain. So this is well needed. And if you aren't in chronic pain, you probably know someone who is. So share that with them. Thanks, everyone, and have a great day.